to brief Kamala Sari to brief the people of Liberia through you on the recent nationwide tour that was intended to assess our readiness as a country in case of any eventual Ebola outbreak. And so she's concluded the tour. She crisscrossed the whole country along with her team and partners. And so we're all here today to brief you with respect to what was observed, what are the gaps, and how to what extent the government like recognition interventions. And so without much ado, I will now turn the floor over to the Interim Director General, Dr. Siawatra Kamano.
Thank you very much, Mr. Weir. Good afternoon to all. Distinguished ladies and gentlemen, developmental partners present, my esteemed executive for technical service, my executive for administration, all division directors present, members of the press, ladies and gentlemen. On behalf of the National Public Health Institute of Liberia and our board of directors, I wish to wholeheartedly appreciate the government of Liberia, the Ministry of Health, and our county health team, our joint security, development partners, and the Liberian people for their continued commitment to protecting our country from the Ebola virus disease and other public health threats. Over the past month, from June 7th, 2026 to July 8th, 2026, I had the privilege of leading a multidisciplinary team to all 15 counties of Liberia to assess our preparedness to fight or prevent any Ebola virus disease in light of the ongoing regional outbreak. This assessment allowed us to evaluate our surveillance systems, our points of entry, our emergency operation centers, our laboratories, national and regional, our isolation facilities, to determine how prepared are we should there be any case of Ebola, God forbid, entering Liberia. We visited 15 points of entries, 9 borders, ground crossings, 4 seaports, 2 airports, 3 regional labs, and 1 national reference lab. What were our findings? Regarding our surveillance structures, I am pleased to report to the Liberian people that we have maintained our system that we established since the 2014 Ebola outbreak. Our surveillance systems remain functional. We have trained cadre of workforce at all levels of the health system, including 98 district surveillance officers, 17 county surveillance officers, and 22 zonal surveillance officers. These surveillance officers remain vigilant and actively conducting case search and reporting. As a requirement for a standardized system, our surveillance officers have been trained in field epidemiology at frontline, intermediate, and advanced levels. They've also been trained in the integrated disease surveillance and response. They've also been trained as rapid response teams to investigate and respond to all priority disease conditions and events. However, the need to be more equipped and always ready to fight cannot be overemphasized. Our findings show that there are challenges with logistics, including mobility, motorbikes, and with rain gear, especially during the rainy season, as our surveillance officers thrive to conduct outbreak investigations and improve the public health in the last mile and how to reach communities. We would like to appreciate the government of Liberia and all our partners and donors for their support towards strengthening the surveillance system. Under the Health Security Project funded by the World Bank, we have received operational support for surveillance officers, to bikes to be distributed to surveillance officers, whilst we await the remaining 100. We have worked with the various county health teams to prioritize and develop a distribution list and submit it to the World Bank. We have also received commitment from the World Bank to train our healthcare workers to detect and manage Ebola virus disease cases at all health facilities. With regards to our emergency preparedness, our Emergency Operations Center, the Public Health Emergency Operations Center serves as a vital coordination hub for emergency response, including risk assessment, resource mapping, planning, training, and exercises. They play a pivotal role in coordinating resources, disseminating information during emergencies, and fostering collaboration among stakeholders. Currently, Liberia has 16 public health emergency operations centers, 1 national public health emergency operations center, and 15 sub-national PHEOCs. The county-level PHEOCs are integrated within the county health systems, and they are led by a coordinator. In keeping with US CDC and WHO standards, a county's public health emergency operations center should be structured as a scalable, legally mandated command hub. It must integrate as an incident management system and be built around core components such as policies and procedures, physical structure, information technology, data standards, and skilled human resources. However, findings from the assessment show that although our EOCs continue to coordinate preparedness activities, thereby hosting all coordination meetings and sessions, there still needs additional investments. Additional investments need to be made to improve communication systems, computers, backup power, and operational resources. Some EOCs lacked essential furniture and equipment, including chairs, television, computers that were required for effective coordination and information management. With these challenges, we want to acknowledge our partners, especially US CDC, for refurbishing our national PHEOC, Africa CDC, for refurbishing our national PHEOC, and also providing computers and printers to all 15 PHEOCs. So Africa CDC has refurbished our national PHEOC, and the US CDC is providing computers and printers to the 50s to enhance coordination. And not forgetting the World Bank, who has approved funding to provide solar power for electricity and Starlink internet connectivity to all PHEOCs. The assessment has been done and the installation will soon take place. With regards to our points of entry, we all know that Ebola can cross our borders through human and animal movement. So we have paid particular attention to our borders, our land borders, our airports, and our seaports. We have assessed a total of 9 land borders, 4 seaports, and 2 airports. Since the declaration of WHO and Africa CDC regarding the Bujumbura BVD outbreak in Uganda and DRC in May 17, 2026, we have screened at the Roberts International Airport over 987 asymptomatic travelers, both Liberian and foreigners, and majority were our Muslim brothers and sisters that are returning from the Hajj in Saudi Arabia. Of the 987, 98%, comprising of 966, have completed the 21 days monitoring and follow-up. 2%, which is 21, remain under active monitoring, with none showing any signs and symptoms of Ebola virus disease. The assessment found that traveler screening continues at our designated points of entry, and that collaboration among Port Health, Immigration, Liberia National Police, National Port Authority, Liberia Maritime, Joint Security, and our county health team remains strong. However, several border facilities require improvement, including better screening infrastructure, holding areas for symptomatic travelers, should there be a case, improved referral system. There's a need for an ambulance to be available and easily deployed, communication equipment, and additional infection prevention supplies. Findings from the assessment also highlighted human resource gaps at the various points of entry. There are limited staff assigned and majority are volunteers waiting to be placed on government payroll. We are particularly encouraged by the collaboration between Liberia and neighboring countries in strengthening cross-border surveillance and information sharing. I would like to take my hat off to our joint security that assigned to official and unofficial and designated points of entry for their strong collaboration. They have been our eyes and our ears where we do not have assigned port health officers. We have also been able to liaise with county health teams upon detection of any symptomatic travelers. We want to acknowledge once again the World Bank for their commitment in providing funding to conduct assessment for the construction of triages or holding centers at designated points of entry and capacity building trainings for port health officers, including joint security. We plan to do integrated training for the joint security at our borders. While there are efforts being made by the National Public Health Institute of Liberia to enroll our port health officers, volunteers, on the government payroll, there are also ongoing discussions with the World Bank to provide incentives for them. We also want to acknowledge our county health teams for supporting our points of entries with PPE supplies, hand washing buckets, and sanitizers, and efforts in strengthening the referral system. We would like to also acknowledge everyone to continue cooperating with the health teams and the Port Authority in order to strengthen the screening and monitoring processes. With regard to our laboratory system, our laboratories remain technically capable but require continuous maintenance of equipment and supplies, including reagents. IPC supplies, waste collection materials, and cold chain capacities were available in the various laboratories assessed. The quality management system and the biorisk management system were introduced and partially implemented at the different labs. We appreciate WHO for donating supplies for Ebola virus disease specimen collection and test kits as well as reagents to enhance testing capacity at the National Public Health Reference Lab. The government of Liberia remains fully committed to protecting every citizen. ENFO, together with Ministry of Health and our partners, will immediately begin implementing the recommendations from this assessment. Priority action points include strengthening surveillance across all counties, improving infrastructure at designated points of entry, addressing human resource gaps, enhancing emergency operation centers, expanding simulation exercises and refresher training, improving laboratory and isolation facility readiness. To the people of Liberia, I want to reassure you that currently there is still no Ebola in Liberia. Kindly note that this assessment was conducted as part of our commitment to preparedness and not because we have Ebola in the country. Preparedness is our strongest defense. We encourage every Liberian to continue practicing good hygiene, report unusual illness immediately, call our 4455 hotline, cooperate with health workers, and rely only on information from credible government sources such as ENFO and the Ministry of Health. I would like to thank our partners, WHO, USCDC, that actually conducted their tour with me, and they provided technical and logistic support. I would like to thank my dynamic team members that accompanied me on the tour. I would also like to thank you all for your attention, and may God bless ENFO and may God bless Liberia. Thank you. So most of the tour, we had about 8 to 10 members on the team, and I was privileged to be on this tour with some very technical and amazing professionals. And I would like to give this opportunity to Madam Alberto Kova, who is our Deputy Director from the Division of Infectious Disease and Epidemiology, as well as my Deputy Director from the National Public Health Reference Lab, Mr. Aaron T. Momodu, to give highlights of the trip from a technical perspective. Thank you. Madam Kono.
Thank you, Didi. So I'm just going to speak briefly about the surveillance structure because the DG has said it all. Those were findings from the assessment that she presented. So we're not going to repeat those results. But with our surveillance system, we just want to assure our people that all of our systems that have been put in place since the last Ebola outbreak, they are still there. And the need for strengthening cannot be overemphasized. We have our frontliners in the various counties. We have them at the district level, health facility, the zonal level, the county level. They are conducting surveillance and they continue to remain vigilant. We also want to emphasize the issue of mobility, which is very key. That was one of the challenges that we saw during the assessment. Our surveillance officers use these motorbikes or they serve as means to reach to last mile communities in the provided for them in past years. They are all damaged, they are not functional anymore. So they need to provide for them, at least to enhance surveillance and improve the work that we do is very important. So like the DG highlighted, we receive support from our key partners, the World Bank, and we also say thank you to other partners as well, especially as it relates to capacity building too, because we also receive commitment from some of our partners like the World Bank to build capacity for our frontliners at the health facility. We have challenges with staff attrition, people that we trained in the past to detect diseases, manage cases, as well as report them to the next level. Some have left the facility due to greener pasture. Some has been transferred to other facilities. So we need to refresh the minds of people that have been trained before and conduct new trainings for those that have taken on new roles and responsibilities. So we also receive commitment, like she said, from the World Bank to build capacity for frontliners at the health facility level so that they may be able to detect, manage cases as well as report. So planning is ongoing for such training, and in a couple of weeks from now, we'll be conducting training for them. Meanwhile, we continue to provide technical support, operational support for our surveillance officers in the field. They are not forgotten. We want to assure them we will support them to the fullest. We also want to say thank you to our DG, who has been very instrumental when it comes to supporting our surveillance officers. So DG, thank you.
Okay.
Thank you, DG, standing on as the group for allowing me to participate in this national press conference. I will be very specific about the lab operation. Currently, there is no Ebola in Liberia. As of 2014, we were testing Ebola, for Ebola in Liberia. That is every suspected case of hemorrhagic disease. For that matter, we also screen for Ebola. If it was meant for Lassa fever, we screen that also for Ebola. So there is no Ebola currently in Liberia. At the national level, there is a suspected case of Butimbuyo today. We have the capacity to test and release results within 24 hours. Our capacity has currently been built more than what we had in place prior to this one that is currently in DR Congo. We have the trained manpower, we have the necessary equipment to deal with, we have current reagents that can test up to 200 different person if there is a suspected case today. Thank God for WHO and IP Dakar, they provided that reagent, and we already rolling down the training to our own staff who already have training in testing Ebola. This is just specific for the Ebola strain that we are talking about. We have the reagent in country currently to test for that. So we have adequate internet capacity to share results within turnaround time. We have even the next level genome sequencing capacity to determine whether vaccine can be developed from this disease, whether drugs can be identified from it. That capacity is currently in Liberia at the central level, National Public Health Reference Lab. At the peripheral level, which we refer to as the county level, that area we managed to identify a few labs because of the hard to reach area, just to reduce the turnaround time in case there is a suspected case. Identify Phoebe Hospital to be one of our regional centers because they have the capacity, thank God for UNC, currently testing hemorrhagic diseases. That is the University of North Carolina. They run a project over there, and we realized that they have the capacity to test Ebola just in case it emerged from within that region. We also went to Tapeta. We identified that Tapeta has adequate layout. UNC also has a project there. They are running. They have the necessary infrastructure that can just be improved on a bit. Other labs that we went to, most of our country facilities were designed years back. They are now meant to accommodate current equipments and other necessary things that we need to put in those labs. So when you get there, maybe that will take us some time. Even though we have earmarked them for future references that we can improve on, but we have capacity in Tapeta, we have capacity in Phoebe, just require minimal upgrading so that they can be like the public health reference lab in terms of disease testing, in terms of sharing results in real time. Those places we can guarantee that Liberia is prepared. At the peripheral, where a lot of the samples come from, where almost all of the samples come from, we also assess their capacity in terms of sample collection material, in terms of IPC, sample collection training. We realize, like Alberta mentioned, staff attrition is truly a challenge for everybody. Most of them are being upgraded to some level, and all of them almost left the area. So there is a concept note already developed, and that is with the national level, so that we roll down training to new people in the system, so that they have sample collection material, but for a bigger outbreak, that may not be sustainable. And that's why we also having this press conference to let you know if there is a case today, we can start something, but that will not be sustainable for more than 2, 3, 4 months in time to come. But we can guarantee that we are prepared today to collect sample from the sample collection point to the public health reference lab. Thank God again for RIDER. RIDER for Health is the group that has actually been transporting our sample to the public health reference lab. We also need to go beyond RIDER point. That's somewhere government needs to also look at. But however, there is no disease in Liberia. We can guarantee testing today and release results within 24 hours based on the capacity we currently have at the Central Public Health Reference Laboratory. Thank you, DG, for allowing me.
Thank you so much. And now, before we turn over to you, I just wanted to share 1 or 2 highlights. I want to commend the team in Grand Cru. It was a difficult journey, and we arrived at the county health team in Bartleyville around 6 p.m. They had waited for us. It was a long trip. And they were able to, on a Friday afternoon, 6 p.m., we were able to reconvene, put the generator on, and we had a PowerPoint presentation. So I was amazed on a Friday, and an agenda, on a Friday afternoon that they were prepared. And that's what is about preparedness. You must be ready at all times, even when it's inconvenient. So I want to appreciate our county health team, our surveillance officers in the hinterland, in the hard-to-reach places. I want to appreciate the Ministry of Public Works and the government of Liberia for the work that has been done on the roads. We were able to just get the beginning of the rainy season, and I can't imagine what our people go through. We want to thank government for the progress that has been made on the road, and it's very important in terms of being able to, our people accessing care, us being able to get samples transferred and so forth. I also want to mention the county health team of Grand Cape Mount. When I asked them, how prepared are you? You know, you're close to Sierra Leone, you share a border. If anything should come across, are you prepared? And the county health officer emphatically said, yes, we are ready. I said, how do you know? He said, I can say this, I can knock my chest, because a few months ago, we had illness, call it viral hemorrhagic fevers. They are viruses that cause fever and bleeding. So in Liberia, we have history with Lassa fever, we have yellow fever, and the likes. So he said we had a case of yellow fever that was in the most remote village in Cape Mount, and our team was able to pick up that case, transfer that case to Monrovia. We're able to get samples, confirmed, do the contact tracing, and make sure that nobody got affected. None of the communities were affected, and none of the staff got affected. And he says, because of that response, I have confidence that my team is able to respond. And that cuts across to most of our country, in that the teams are on standby, they're ready. What they need is support. We need to be able to get the PPEs, personal protective equipment. We need to be able to get IPC materials. I want to commend the joint security. Another highlight is we focus on our initial objective was to look at our points of interest and borders. But along the way, we came across a lot of checkpoints, and I was impressed to see hand washing stations at those checkpoints. And we are aware of the porous borders. Liberia has 49 official borders and over, I would say, 200 unofficial borders. And we only have 8 that are designated where we have port health. So you imagine there are a lot of places where we don't have our port health. But guess what? Because of our road network, even if you cross the border, before you can get to the main town, you have to get on the main road. And because of the checkpoints, there's an added layer of protection. So we want to train we're working together with the joint security to make sure that there's training. And I want to commend the Cape Mount county health team. Is it Bomi or Cape Mount before I get in trouble? At the Clay, I think it's Bomi. At the Clay checkpoint, they've already assigned a nurse to do temperature checking and to ensure that there's hand washing. So when all else fails at the borders, at least at the checkpoint level, we can also be able to work with joint security, because it's not only for health reasons, for immigration purposes, drug enforcement. We can strengthen the internal checkpoints. So on that note, I want to give you an opportunity to ask questions and ask for clarifications. But thank you so much.
Okay, thank you very much, Captain Commander. Just briefly, let me introduce some members of the high table. On the left is Dr. Julius Viviana. He's the Deputy Director General for Technical Services. And on the right is Comrade Director Ishmael Homikiari, Deputy Director General for Administration. So the floor is yours. Just call your name, your institution, and you ask the question. So we'll start with you.
Yeah, thank you for recognizing me. My name is Anthony Gray, and I report for ECOWAS Radio. Having done the assessment, what are the gaps that you have identified so far? What are still exist?
So we'll take the first 3 and we'll go to the next 3, okay? So yeah, you.
Thank you. My name is Blamoto. I report for the Liberia Investigator newspaper. How many volunteer port? Let me get a question clear. How many volunteer port health officers are we talking about, and what impact does their exclusion on the national payroll have on the preparedness? And due to that, how much did the government, through MPhil or MOH, receive from the World Bank, and I kept emphasizing on the support of the World Bank? Thank you.
Yes.
Yes, my name is Yekesi Zwobwe. I report for Spoon FM and TV. So you outlined several challenges. So what is the most pressing of those challenges that you think need to be addressed right now? And secondly, I heard a lab technician talked about sustainability. according to him, the system that we have in place right now cannot be sustained for maybe over 6 months, just in case there's any case of Ebola virus. So what are you doing in that respect, to be able to address that situation?
So thank you. So the DG will respond to the first three questions, and we'll take the second round of questions.
Thank you so much for the questions. They show that you're paying keen attention. So gap number one will be human resource. In terms of personnel at the various surveillance points, from zonal, district to county level, and also at the lab with staff nutrition. And then with personnel will also be training. We identified that there's a need for refresher for those who served in 2014. That's over 10 years ago. And the strain we're dealing with that is in East Africa is different from what the Zaire strain that was in Liberia. For example, there's no vaccine and there's no treatment. So we have upgraded our case definitions and we've sent that throughout the country. And we're also working on doing the training. The other gap that is very essential is IPC, infection, prevention and control material. So simple things that we take for granted, and the materials needed to wash our hands, the hand sanitizers, the buckets, the water, to the gloves, the mask needed to protect our people. This current outbreak, they've had over 1,500 cases confirmed, and a third of those have died. 500. And what they noticed among the deaths, there's a high proportion, over 30% health workers. When health workers are dying, that means there's no infection prevention control measures. That means they're not protected because they have to directly touch infected people. So we, God forbid, that would not be our case. We don't have Ebola, but we want to make sure that we have the required protective equipment for our staff. So those are the personnel and the IPC gaps I would like to highlight. In infrastructure, we have a country where we have rain for almost 8 months. And imagine at the checkpoint having to go and do screening under the rain. So chances are people will allow people to pass. Who's going to stand under the rain and the rain beater? So we need to be intentional in terms of our structures in place, not only for the port health, but also for our joint security, that they're able to carry out their duty in a conducive manner. Regarding the port health, so prior to my commencing the tour, we worked with CSA. There are 42 port health that were identified. They were previously supported by a project that was implemented by Plan International through Global Health Funding. So that project ended in December of 2025. So then I was informed, I think March or so, that they had not taken pay for 2 months. So we were able to get them to complete the personal action notice, and we're working very hard with CSA. I want to commend the Director General, Honorable Jokai, for his support in understanding this emergency that we have now as a nation. Our frontliners cannot continue to serve as volunteers. We're also in-house able to secure, we're able to pay 2 months of their back pay to encourage them. We're trying hard to sort out the payroll issue. It's one of I will highlight also as one of my, that's right. World Bank. So there's a health security project that is being implemented. It started last year, 2025. It's a 5-year period. Is it? Okay. Maybe I'll allow you to talk more now. So there's a 5-year project, health security. As the name suggests, it's interested in health security, of which surveillance, laboratory, outbreak response plays a key role. And there's a component of the project where if there's a need, it's almost like a contingency. If there's an emergency, you can write to the bank to have that fund made available. So although we don't have Ebola in the sub-region or in the country, we know that the challenge we had in 2014 was lack of preparedness. And once you are prepared, that's the best we can do. Prevention is better than cure. We don't have, it costs the world over 2 billion. I mean, it was 5 billion to contain the outbreak in Guinea, Liberia, and Sierra Leone. We don't have, our national budget is not even $1 billion. Okay, it's now just over $1 billion. We don't have that money. So what we can do is invest in prevention. So we're able to write, and thankfully the bank has approved, and so we're working out the details. So the funding is not yet available. As you heard me say, we're working with the bank, And so once, we're hoping that will happen, with World Bank, there are processes. So we've made an application, they've agreed, and so we're working out the details. So, but we're hoping to cover, whilst they are not on payroll, we can cover them with the bank. But once you're on payroll, the bank doesn't cover your staff. Personnel that are on payroll should not be covered by the bank. So regarding sustainability, the laboratory system is such that it needs a continuous supply of consumables and reagents. I say that the machines need to eat, they need to drink. So to run a test, there are solutions, there are medium that you need to mix, you need to replace that. So what he's saying, in essence, is that we have enough to last maybe 3 months. And normally we do our procurement in such a way that we apply for supplies 3 to 6 months. So because they also have an expiry date, you cannot order for 1 year and 2 years and then they expire on you. So we normally like to have at least 6 months supply in country. So what he's saying, the quantity we have now, should there be any outbreak, we will go for 3 months. But we're not going to wait for 3 months. We're going to also apply for more. But maybe you okay with that?
Yeah, DG, you said it all. Like the current reagent we have has a shelf life of 1 month. 1 year, and we already gone 5 months into that. So you can order for more. Otherwise, you have a lot of expired things. And currently, there is no outbreak in country. You will now want to order for more and then just have them in stock. That would be a waste. The reagents are very, very, very expensive. For Lassa, EVD, that is the Ebola and meningitis, those 3 diseases, we're using close to 400,000 every quarter to buy reagents, at least to talk about the rest of the diseases that are being added. For this new strain of virus, that's something that is very, very, very costly. So we don't want to waste the reagents. But at least we have something just in case there is